It's a very common scenario for people to take psychiatric medications in hopes of feeling better. And in some cases, they will feel a little bit better, but the price they pay long term is a lot of metabolic dysfunction, weight gain, high glucose and insulin levels, type 2 diabetes, obesity, and a lot of dulling of their natural emotions, creativity, and sedation, feeling drowsy, all kinds of quality of life issues and physical health side effects. Many of them are paying a really big price for whatever relief they are getting from those psychiatric medicines. We know from the studies and years of clinical practice that these medicines, while in some cases they can be very important and useful tools in some situations, I still use medication in my practice. I use less and less of it all the time. But we know that they do fail most people. They do not bring enough meaningful relief to enough people. And their effectiveness rates are well below 50% for most psychiatric
Oh,
conditions.
wow.
And so, and with lots and lots of side effects, very, very common. So we do need new strategies. So now what is going on when someone says, well, this psychiatric medicine is actually making my mental health worse? You can absolutely see that. I've seen it more times than I can count. Psychiatric medications can have side effects that can worsen depression, they can worsen anxiety, they can worsen sleep patterns, they can worsen, they can really just have just about any kind of mental health side effect you can imagine, depending on the person and the medicine. And then they say, okay, well, I'd like to come off this medicine. And they try to come off the medicine, and lo and behold, things get even worse. And so they go back on the medicine or they raise the dose back up again because they feel like they can't get off of it.
Right.
They feel like they are stuck because when they try to reduce the medicine, they feel worse. 9 times out of 10, that is a withdrawal issue,
Mm.
not an issue of needing the medicine to be well. And the problem is, this is a very common, widespread problem in psychiatric practice, is that most psychiatrists, well, all psychiatrists, none of us were trained in de-prescribing. None of us were trained in how to safely taper off
Mm.
psychiatric medications. None of us were trained about what happens, what happens in the brain when you lower psychiatric medication, what's going on there. Why do people sometimes get withdrawal symptoms? We didn't have any classes on that. We were
Wow.
taught how to prescribe medicines. We were taught how to add medicines together. We were taught how to adjust doses of medicines. We were taught about side effects of medicines. We were taught what lab tests to order when you're prescribing medicines. We were taught about all this interesting chemistry about how the medications work. We were not taught how to safely de-prescribe medicines. So what's true about this is that psychiatric de-prescribing is a very complex art and requires a lot of experience and a lot of knowledge and a lot of patience, a lot of skill. But it is possible. In 25 years of prescribing medicine, I have never not been able to get somebody off of a psychiatric medication. It's just that you have to know how to do it. And you must
Right.
be extremely patient. It must be personalized. Everyone's different. And you have to go very, very slowly in some cases. It can take months to years in some cases to come off certain medications. And I'm not saying that everyone will be able to come completely off their psychiatric medicines and feel better. Some people will continue to benefit to some extent from certain medicines. Everyone's different. But most people will be able to safely and comfortably taper off their medicines if they have good clinical guidance to see how they feel without them. Well, I think what's happening is that most of us are just not mentally well,
Mm.
because most of us are not. I mean, again, diet is not the only cause, but if you look at what most people are eating, you need to look no further for all of the root causes of mental health conditions in the standard American diet. You have
True.
every ingredient you need to disrupt brain chemistry. You have every ingredient you need to create insulin resistance and a shortage of energy to the brain. You have every ingredient you need to cause damaging inflammation and oxidative stress. And you don't have the ingredients that you need to thoroughly nourish the brain. Of course, our brains are not functioning properly. How could they?